Employers added about 288,000 jobs last month, meaning the jobless rate plunged to 6.3% from 6.7%. But here in Austin, those numbers are much lower at 5%. And here's an interesting trend. When more people are employed, more people are going in for cosmetic surgery. Here to explain the mindset behind that is Dr. Malin Kerr with Synergy Plastic Surgery. Good morning to you.
Good morning, Erin.
So one might assume that if you've got a job, you might feel more financially secure and go for some of these procedures. But what is the mentality?
I think that definitely that's true. And I think that we see that people who have a job have potentially some savings. If you have a secure job, you have potentially the opportunity to have some time off work. And I think that if you look nationwide, and especially I would say locally, we see that plastic surgery procedures are definitely tied to economic outlook and how the overall economy and especially even the GDP on a national scale is performing.
Mm-hmm.
So.
What was it like a few years back when the economy tanked?
Yeah, so in 2008, I think it was as bad as it's been, and we saw about a 9% decrease in cosmetic surgery revenues, and those have been slowly on the rise, creeping up 1% last year. But what we saw is when really the economy does poorly, people still want those procedures, and there's a pent-up demand. And so now that things are better, we're seeing a rise in cosmetic procedures and more expensive surgical procedures. But when the economy is low, people still want to get stuff done. So we see Botox, we see fillers, we see non-invasive, sort of less expensive procedures being done at significantly higher rates.
Yeah, I've heard about people wanting to put their best foot forward, look their very best when they're going in for those job interviews. And we were talking just before this, some people might have a break that they know about when they can fit some of those in.
Yeah, I've definitely done a lot of facelifts, a lot of body contouring procedures, eyelids, stuff that might take a month or two to look, really good, but can make you look maybe about 10 years younger. And I think it's definitely people feeling like, gosh, this is a competitive workforce. I need to compete against a younger person. And how do I do that? How do I put my best foot forward? How do I show people that I'm still young? I can still do the job. And for a lot of people, facial rejuvenation is a way to go.
And it's not just women doing it.
Yes, it's true. Yeah, I definitely have done more than one facelift on men, do eyelids on men. I think that certainly, the eyes really are the first thing that kind of shows your age, and so people really want to kind of try and get that youthful look and just show that, hey, I am competitive in the workforce.
Are things back to where they were before the economy went down? Is it that good again?
I don't think so. So, I think that the best numbers are probably in 2005, and we're getting there. And this year has been good. I think that if we look at locally, I know that all the surgeons in town saw a dramatic decrease in procedures in September and October, and I think that that was primarily related to concern about the possible government shutdown and what's the economy doing? Is the credit rating in the United States going to go down? And so as basically that sort of resolved into January, I think that we see a trend in employment increasing significantly since January. With 288,000 jobs added last month. The local unemployment rates in Austin are 5% or less, and so this spring I've seen really just an exponential curve in the number of people seeking both minimally invasive but also invasive procedures that are more expensive and require more time off to recover.
Yeah, very interesting how everything is tied together so closely. Dr. Kerr, thank you for coming in this morning. Good information.
Yeah, my pleasure. Thank you.